For a change, an oldie among the youngsters. Uh, so my brief study is about bacteriophages, a novel approach to combat multidrug resistant corneal infections. It's a small study on the efficacy of bacteriophages against multidrug resistant Pseudomonas keratitis in bacterial keratitis corneal models. So as you know, India tops the world in the blindness as well as visually challenged people. And the recently conducted study by the Ministry of Health and Family Welfare found that the prevalence of blindness is very high. The prevalence of corneal blindness is close to 8.2%, the second most common cause of blindness. So we have a huge population who are corneally blind, and corneal infections are a major cause of this. Corneal infections happens, it's termed as a silent epidemic by the Aravind group, and we have about 114 corneal infections per lakh, which is more than 10 times what happens in any of the developed countries. We all know about Pseudomonas keratitis, that it causes rapid spread and it can invade the cornea within 24 to 48 hours. There are multiple attributes which contributes to that: biofilm, intrinsic resistance, and a lot of factors which we are not very clear about. And approximately all over the world, 30% of the Pseudomonas are seen to be having antimicrobial resistance and multidrug resistance. You know that phages are viruses which attack the bacteria, and they need a bacterium which are quite, and the peculiarity of phages is that it's quite specific to that particular bacterium. So this phages, especially against Pseudomonas, has been used in cystic fibrosis and otitis media. In corneal infections, there are no studies per se, but there are some isolated reports. The aim of our study was to evaluate the efficacy of this cocktail of 3 bacteriophages against the multidrug resistant Pseudomonas bacterial keratitis model. So Pseudomonas aeruginosa specific bacteriophage AMP2, 3, 4 and 5 are isolated from the water sources. We know that the phages are taken from this contaminated water or old rivers. So this water sample was taken, it was enrichment broth was put into that, and other nutrients were added to that, and then we keep it overnight and you centrifuge it so that we get a concentrated phage concentration. So this is filtered with a 0.22 micrometer syringe filter so that the bacteria are filtered out. And then again we do this process of centrifuging to make it much more concentrated. So in the preliminary data done by our biotech team, we found that there's a combination of AMP2, 4 and 5 in the ratio of 1:1:1. 1 ml of that gives the best possible results. So we made a corneal infection or a keratitis model which is described in literature. In this, a corneal rim is taken, which is these are tissues which are not used for therapeutic or optical purposes. This is filled with DMEM agar. Once it is solidified, it is reversed, and you keep it in a 35 millimeter petri dish and fill again with DMEM. You make 3 scratches on the cornea. The intention is to make an invasion into the anterior stroma as well, and keep a trephine on that, as you see in the picture over here, and you rotate it 3 times so that it penetrates about 50 to 100 microns. You make a water seal by putting cyanoacrylate glue all around it to make sure that it's a water seal. And this Pseudomonas solution, which contains about 10⁸ Pseudomonas per ml, is kept for about 3 hours. After 3 hours, the phage pellets or the phage concentrate was put onto it, and it was kept for about 6 hours. This time duration was decided by our microbiology team based on the bacterial properties. So once it is done, the buttons were homogenized. That means it is ground, and the resulting suspension was spotted on agar plates to look at the colony enumeration. So we used only 4 pairs of corneal buttons, and in each we used one as a pair as a control. So the colony enumeration of the EFU, the colony forming units, were done at 10⁻⁻1. That is my 1/10th, 1/100, 1/1000, and 1/10,000 values in LB agar plates. So this is the first pair in which once you put this, you can see that the white, flat, flocculent growth of Pseudomonas that you see, once your concentration goes down, the amount of growth is less. And in the phage treated, you practically see no growth at all. The same thing in the second pair. Almost the similar values in the third pair also. Like in this, I think in the 10⁻⁻4, you can see some colonies. And in the fourth pair, we see that in the Pseudomonas, this particular strain, it has some pyocyanin, that greenish color is also there. But in the phage treated, it is almost not there. So we found that there is 90% reduction approximately of CFUN consistently in all 4 pairs of corneal slit button, and it's highly effective in killing MDR Pseudomonas aeruginosa. So Pseudomonas aeruginosa is listed as a critical pathogen by WHO, which needs urgent novel antibiotics, and industry is actually shying away from it, and we have to look at ways which are beyond antibiotics. So a phage cocktail, this particular cocktail of AMP2, 4 and 5 is seen to be extremely effective, at least in the corneal buttons that we studied. There is need for animal experiments or human trials to test this. Thank you.
This you extracted from the river water?
This was taken from this one, sir. Not well water, from that basically lagoons only. Yeah, lagoons.
Lagoons.
Yeah. So phages are seen to be, well, it is seen in all these stagnant water and all that, and it is seen that the phages actually reduces the bacterial count in these.
So we can advise them to corneal ulcer patient to bath and take a bath.
That I don't know. So that probably is an environmental way of reducing the amount of bacteria that is there.
And this Pseudomonas that you tested, how do you know it is multi-drug resistant?
Yeah, because we got it from the laboratory, sir. That's all we
That
know.
was already a
that is.
Wockhardt has come out with a new antibiotic, which is against
the Indian
MDR,
one.
Yeah,
Sir?
Indian
Okay,
one.
okay,
Yeah. It's just come in the news. Any
Yeah,
experience with that, or
No, sir.
they have launched a new something like I think it's erythromycin group of antibiotic. They say it is against multidrug resistant.
Multi-drug resistance bacteria. Yeah. I also just said, but I have not read in detail about it. No information.
Thank you.
Thank you.